Hey, Dental Nachos crew. This is Paul, Dr. Nacho. I'm here talking with two awesome dentists. I have a question for you. Do you need a job to create the most beautiful emergence profile the world has ever seen? A job to pay back your loans, a job to live your best dentistry life. I'm here with two of my favorite Nachos, Dr. Ozzie and Dr. Ariel. I'm going to start with Dr. Ariel because she sent me this amazing sign, just be nice and eat nachos. I hold it when people make me upset. So I basically have strapped it to myself at all times. Ariel, that's the life of a Dr. Nacho and dentist. But I'll let you share first. Where are you in this dentisting circle of life? How long have you been out of dental school? And how can a licensed dentist help you decrease stress and increase success where you are?
So I am 7 years out of dental school. Well, I started at the same place that I'm at, the Rural Health Clinic in FQHC in Grantsville, West Virginia. I'm currently the dental director there. We used to be a 3-dentist practice and a 3-hygienist practice. We are now down to myself and 1 hygienist, and both of us are extremely booked, extremely busy. So certainly having another partner in crime would help reduce my stress significantly. I would say where I'm at, I feel very fortunate in the flexibility of the schedule because I am a parent too. So, you know, right now I'm currently in my car watching a baseball game immediately after work here today. So, you know, priorities are very important. Work life, home life, trying to balance that. With my current job, I leave it at the door, which I love, and I can come. And but we definitely, someone who is straight out of dental school or someone who's a seasoned age dentist, where we would love to have anyone where we're at right now.
Awesome. Thanks for sharing this. And you know what's interesting? I realize dentists, they follow directions with bonding, but they don't follow directions at sea and stuff. You ever notice dentists at sea, they don't follow directions? So I just want to put out, if you want to connect with us about these jobs that you see, just text job to 215-543-6454. Your job is in West Virginia, Ariel. We're going to go to Ozzie in a second. Before we go to Ozzie, tell me, I'm actually interested, like the FQHC, you're working 8 to 5. What type of work would this dentist be doing? Like what type of procedures?
So as you can imagine, in a rural area, there's a lot of toothaches. We have a lot of walk-in patients. I hate to use the phrase hero-donics, but I do a lot of large MODBL, big restorations. The great thing about where I'm at is we have a CIRAC machine and we have a sliding scale fee. So we're able to give people crowns at a reduced cost and, you know, restorative work at a reduced cost. But mostly I'm doing kale and quinoa dentistry. Is that what you
right?
said?
Thanks. You watched a lot of episodes. Bread and butter. Ozzie hasn't had bread and butter in the past 5 years. Look at that shape he's in, yeah. Right? So yes, kale and quinoa dentistry is everyday dentistry. I think they found out bread and butter is really not good to eat every day. So Ariel, perfect. Hang with us for a few more minutes. We'll come back next one. Now we're going to go all the way over to New Mexico to Dr. Ozzie. Dr. Ozzie, share with us where you are when you graduated dental school and why you're looking for a dentist to join you as an associate.
Yeah, so I graduated in 2018, so I've been out for almost 3 years. Purchased my first practice in September of last year, and we are in the process of merging a second practice in, so we need an associate dentist to take over the retiring dentist practice. And our office is built big enough for about 2.5 dentists, so it's 10. And so we're just planning to expand and grow.
When is the dentist retiring and hanging up the handpiece in a big ceremony? There should be a huge ceremony for that one.
Right? Yeah, no, we want to have a taco truck up in the front.
Yeah.
There's one right down the street, so we're excited. He wants to get out as soon as he can. So the way that I envision the new associate coming in, the retiring dentist will get to introduce the new associate to his patients. And then he said that he's ready to go as soon as the new associate comes in, but he's willing to stay up here. So.
Cool. So, and you're in New Mexico. So 2 things you both said, I always try to be delivering value, is the why is so important. Is your associate position a car or a boat? A car is a need, a boat is a want. And both of you have shared really good whys. I mean, Ariel, it sounds like you guys have way more dentistry than what one human dentist is capable of doing. And then Ozzie, you have someone replacing a dentist. So, I mean, both of you have, I'll tell people my golden nacho tip, when you're replacing a practicing dentist in some capacity, you know there's a schedule of patients. Busy is a feeling, not a fact. A boat associateship is not a bad thing, but you just want to make sure that if you're in a position where you're getting a job and someone says, I feel really busy, you dig into more of that. Now, Ariel, people need to make money. So what is the way, how much money would they make working in your program roughly so you can manage their expectations that way?
So it is a salary based pay. They try to be a competitive salary. I would say anywhere from 150K that's negotiable and up. But to add to the toppings,
Nice, like that.
there are a lot of what I would consider added benefits. I mentioned in my post, there's all kinds of paid time off, paid holidays, your ADA and your DEA and your licensure fees are paid yearly, So there's a lot of added benefits to the position in addition to loan repayment options, which has been huge for me.
Awesome. And this is, just like the treatment plan, we love talking about this. It's the right fit for the right person at the right time. And what I just try to do with Dentist Job Connect is to just make people aware we're a cave profession. How do you get this information out there? So awesome, Ariel. I'll just ask you one more question, then you definitely can go to that game. But Ozzie, tell me about the pay range where you are and what procedures will the associate be doing?
Of course. So we are offering a $15,000 monthly guarantee. So it comes out to about $850 daily guarantee.
That's awesome.
And that's just, I think that's the base. I think that the associate would have the potential to earn a lot more depending on their skill levels. So 50% of my practice right now is implants, and I do have an XNav. So if it's a bad, and if they want to learn some implant placement, I can definitely help and teach that.
Ozzie, I don't know if you have any small humans that live in your house like Ariel and I. People call them children.
No small humans for me.
But one of the things I'll just share too is it's really this thing that doesn't show up on the stat sheet like Ariel's about to watch baseball. When you can be working with another licensed dentist on a daily basis, even if that's through text and email and FaceTime, it sounds like Ariel, you guys might be in person together, Ozzie too. That's so valuable to just your stress, your sanity. I kind of liken it, Ariel, like if you're at a party and you're only parent on duty, that is very difficult, right? So if another parent shows up, you just want to give them a big hug and be like, this one is eating dirt. It's my kid, make them stop. So, I think that that's just a really valuable part of finding your way in this circle of dentisting life. I think dental school just doesn't showcase what it feels like on the inside part of your body to dentist every day. I have this guy, it feels like this at times, right? Inside. And it doesn't mean it's a bad career or a bad job. It's just you don't know all the things that are coming at you at once. And you can say to someone, hey, Dr. Ariel, hey, Dr. Ozzie, what do you think about this? Whether it's texting an x-ray, don't text it, it's against HIPAA, send it secure. Give it to a crow and have it fly it over to Ozzie's office. So really appreciate you sharing. So we have New Mexico with Dr. Ozzie. We have West Virginia with Dr. Ariel. As we wrap up, Dr. Ariel, so you can watch your awesome child's game, share with us, how can someone reach out to you and maybe just something non-dentist about working in that area or living in that area? Pretend we're normal people. I know it's hard, right? And just say, if you were a person who came here when you're outside the operatory, what would you do for fun and how can people reach out to you?
So for me, my side gig is farming, believe it or not. I have chickens and goats. But as far as fun, we're on the Little Kanawha River, so a lot of people kayak, hiking, outdoor activity mostly. You can imagine in a rural area. I have a huge flower garden, vegetable and fruit. So
your hands are purple.
Perfect. And then Ariel, how could people reach out to you directly? We're going to connect them, but how could people reach out to you directly?
So they can reach out to my email. I put that on the Dental Nachos post. It's Ariel, ARIEL .wvdds @gmail.com. And, I'll even provide my personal cell phone number if they shoot out an email, and we'll go from there.
Awesome. Thanks, Ariel. Enjoy your baseball game. Really great. Reach out to you. You're an awesome Nacho. Really appreciate it. Dr. Ozzie, have a good time. Dr. Ozzie, same thing for you. Give us a plea to someone out there to come join you and how they could reach out to you directly before we bring up our next two guests.
Yes, so they can text me. My phone number is 209-777-8150, or just email me at ozzierodasdds@gmail.com. So it's ozzierodasdds.
Awesome.
Or info at highdesertdental.com, and you could reach my awesome manager and wife, Taylor. So she makes all the major decisions,
Oh, Yeah, Taylor, I'm going to do a show. So I'm married to a dentist. What next? That's for you and my wife and other people. I think that'll be my greatest glory. I'm
She's
married
over
to a
here.
dentist. Why did I do this? My wife wants that show. So thanks, Taylor. Now tell us, Ozzie and Taylor, before we bring it next to you guys, pretend we never went to dental school. We're normal people like Taylor, and we came to New Mexico. What would we do for fun? Taylor, you could say too. What would we do for fun?
Come hang out with us. We do things every weekend.
Is it like outdoor stuff, or what's the New Mexico life like?
Yeah, there's a lot of outdoor fly fishing. The only place where you can wake up and see hot air balloons flying out your window.
Nice. Well, there's a lot of people like that. You're a really great young dentist, Ozzie, and really appreciate you sharing. Hang around. You could share in the Facebook Live or chat for your next patient. We want to get someone connected to you and Dr. Ariel. Really appreciate it.
Thank you.
Awesome, guys. We have two more practice owners here, Dr. Chris and Dr. Tina.
Yeah, popping on to say Dr. Chris and Dr. Tina can start your video.
Perfect. So we got Dr. Ariel and Dr. Ozzie. Awesome. We have West Virginia, Dr. Ariel, New Mexico, Dr. Ozzie. If you forget everything, just text in this. Jill, our Job Connect director, does a great job putting all of the jobs, 100 plus jobs, in an email. So I have Dr. Chris here. Dr. Tina, you're welcome to pop on whenever you're ready for your video. But Dr. Chris, thanks for joining us. We are talking about you need an associate to increase your success, decrease your stress. Tell us about where you are and why you're looking for an associate. I think you might need to unmute yourself there. Sorry, it happens sometimes.
Better?
Yep, perfect.
Okay, sure. Questions again?
So where are you dentisting here on Earth, and why are you looking for an associate?
I'm here on Earth in Plymouth, Massachusetts.
Cool.
And I'm looking for to maintain it as a private practice. I'm hoping to find an associate that can learn the same way I did 1,000 years ago, which is to associate for a couple of years and then purchase part or all of the practice.
Awesome. And tell us a little bit. I know we're dentist people like details. A daily day in the life of your associate. What procedures are they doing most of the time? Restorative? Is there opportunities to do other procedures? Just tell us a little about your daily dental menu for an associate.
Well, the daily dental menu was exactly what would come in next. We literally would take every other patient and see that patient. So I know it's a vastly different world as associates now. There's usually some sort of influence that's telling you which patients you're going to see and what you're going to do. So to answer your question, a long-winded answer, I suppose, would be that you would do what the patient needs. You would start from the beginning and treatment plan and interview the patient, find out their needs, find out what they need from your point of view, and treatment plan. And
awesome. That sounds like a great system. What skill set, like let's say someone's watching in saying, oh, I'd like to go to Massachusetts. This sounds like a good fit for me, but I want to make sure I have the skill set. What are some things that would be good for them to have clinical wise? Is there anything that they should be particularly competent at to survive and thrive at your associateship? Or you teach them everything?
I think not. No, they already actually know everything. What they don't know usually is, how can I incorporate that knowledge into real life dentistry? Yeah. And that's most easily learned as you do each different procedure. I think that's one of the faults in the present system of associating in a corporate setting, for instance. Sometimes you're pigeonholed into only perfecting certain aspects of dentistry.
Gotcha.
Whereas, again, the way I learned many, many years ago.
When did you graduate from dental school?
1986, not 1886, 1986.
1986, so, 35 years in.
That's correct. Yeah, that's good math right there. Yeah, absolutely. Yeah, but I learned, and every other associate back then learned by doing. You learn by whatever that particular patient needed, and you oftentimes use that same, or at least a similar training system that you learned in school in terms of the order of doing the dentistry to get the best results.
Awesome. Now, how could someone, Doctor, someone saying, this sounds like a fit for me. I would like to learn from someone who's been doing this for 35 years. We affectionately call you a seasoned age dentist, a SAD, which is a nice term because you're so
It's a perfect acronym.
Yes,
actually.
I'm
Yeah.
10 to 25 years. I'm a medium age dentist. That's a MAD. So, how can people reach out to you directly? We have our hotline. You text job, we can connect you with this Massachusetts job. But Dr. Chris, how can someone reach out to you directly to learn more about your position?
I think simply calling my cell phone. I don't try to make it too complicated.
Sure.
508-524-2253. Really, I think it's becoming more and more of a unique opportunity to continue a true private practice.
Great.
And get an opportunity to learn how that works. And again, I think the biggest stumbling blocks that most young associates now come up against is the money aspect of it.
Yeah.
But the truth be told, that you can speak to this to everybody out there that has that doubt, that when you're an owner of a practice, a private practice, or I suppose a DSO as well, but if you're an owner of a true private practice, you get both the benefits of working in the practice, so you can showcase your clinical skills, but also the monetary gains that come from that are not as publicized probably as the percentage you get as an associate, but they're there nonetheless, and it's significantly greater than what you would earn as an associate.
Well, I appreciate a couple of things. One, just being part of the program, but two, just sharing your story about doing this for 35 years, the desire to continue your private practice and really mentor someone working with you, right? And whatever that leads to next, our goal is to make these connections. So to reach out to Dr. Chris, you can text job to 215-543-6454. We'll put Dr. Chris's cell phone in the chat. Dr. Chris, I don't know if you're part of our Facebook group, but go and make some comments about some fun things that you can do in Massachusetts. And, every day you're at your office, pop a comment in. You can throw a picture of a case. You can talk about a patient, no HIPAA, don't violate HIPAA. I don't even visit the hippos at the zoo, too risky. But, share something about that. My goal is for us to share more of our stories so that people really can bond together, to use a dental term, and find the right fit for them.
Great, will do.
Thanks, Chris. Appreciate it very much.
You got it, buddy. Thank you.
We have the awesome Dr. Tina. She's going to be joining us via audio, which is totally cool. I'm totally comfortable talking on Zoom to myself. That's very normal for me to do. So Dr. Tina, share with us a little bit about your position, where you are, and why you're looking for an associate.
Hi, I am in Grafton, Massachusetts, so similar vicinity.
Awesome.
And I too have a genuine private practice, almost entirely fee for service at this point, which was a big leap of faith, just dropping the whole Delta.
Service, I like that. I'm trying to do that myself. I've done this for 19 years, Tina, and these insurance coupons are just driving me insane. It's my morale. I don't even know if it's the money, Tina. It's just my morale. So I'm with you on that.
Totally.
I don't have any judgment. There's many different ways to run a business. We've had many insurances for many years, but I don't know. I just can't mentally take it. It's just this is my therapy session with you, Tina, about insurance here. So now tell us the why. Okay, so you have this practice, private practice, and why are you looking to share the joys of dentisting with another licensed dentist? Tell us that why.
Well, the why is quite simple. I mean, I don't like Dr. Chris. I really want to be able to stay totally private and not be owned by somebody bigger, because there's just so much more freedom to do things the way you want to do them when it's yours. And I need this only because we've grown. I started this practice 0 charts on the shelf. I didn't acquire anybody's.
Cool.
Back in 2004. And then when things were starting to explode on me, my husband and I looked for a location. We built a really beautiful building. We have an orthodontist that rents at the far end of the building. I have a hair salon in the middle, and then my office is half of the building.
How many opportunities do you guys have?
10.
Oh, great. So, and is it right now only you, or do you have other dentists there right now?
So I have a doctor in there with me now, and I had another full-time associate that I brought him on just after we were able to reopen. after COVID. And then I let him go in February because he was very unethically treatment planning his wallet. I have zero tolerance for that.
That's good, good zero tolerance thing. And what you share there, Tina, I just think we just need to embrace more as a, profession, is that we like things to be predictable, but relationships can be unpredictable. So trying to find the right fit for us in dentistry is not supposed to be easy, but when you find that fit, it's worth it. So tell us a little bit about your fit. What type of dentistry clinically would be a good, what skills would be good for this associate to bring to your practice? Restorative, are there any specialty skills that would be particularly advantageous?
Yeah, so I like to be able to keep pretty much everything in-house within reason. There are some things that are just out of the scope of a GP, and being able to realize that is half the battle. But I definitely want somebody that is comfortable doing extractions. Don't have to do third molars, but your basic extractions, surgical extractions, that stuff is kind of all of what we do. Root endodontics, first molar, second molar, all teeth need to be treated. Crown and bridge, Dr. Drill and fill, of course, that's the standard stuff.
Sounds like a true nacho plate of clinical procedures people can do, but you being, how many years you've been a dentist for?
25.
Yeah, so you're a little past me, but not too much. But then you're there as a mentor to kind of help manage, are you there to help manage the associates when they need maybe just someone to ask a question about a case, or is this too difficult for me? Or maybe if they
Absolutely.
want to explore a procedure.
Without question, I am willing to, stay after work, go over cases. I think what I've learned in the past, having a couple other associates, and then, Dr. Allison is going to be leaving me in August to go back home to Erie, Pennsylvania. The one thing that I've learned is kind of calibrating treatment planning is super important. That's probably been the biggest problem I've ever had with an associate, is calibration of treatment planning.
I think it's important. I'll use an example because Ariel was on here before, and then Ariel Meredith is watching. And I know that Ariel Meredith, our client services director and our hygienist, if we go get a drink at Elvez, she wants to get a spicy margarita, but I don't want that, right? So what happens is if patients get an unexpected spicy margarita when other people are serving regular, it just confuses them. And I really actually think that's just an awesome point for us to learn from, that calibrating treatment planning in an office is so important within a framework of reasonable care, right? Because otherwise it confuses the patients, confuses the team, and really winds up confusing the dentist.
Yeah, the level of patient confusion was just, it got to be completely unacceptable. And then when I went and looked at what he was treatment planning, I realized why it was unacceptable. But yeah, I guess if my biggest takeaway here from my experience, good, bad, and otherwise, is going to be I'm happy to mentor, but
Awesome.
More than anything, calibrate. I don't want to be checking your patients in the middle of the day. You graduated from dental school, you should be able to do that. But to just chat about things and how would you handle this?
Sure.
And honestly, I have to say, I have learned many times just as much from my young dentists that I've had as associates, sometimes as they've learned from me. I mean, there's just so much out there to learn.
I'm so glad you said that, because that happens in all phases of life. We could say our grandparents are really knowledgeable, but they don't really know how to use social media. We might, and then someone younger of us knows something. So it's such a Nacho theme to say we can learn from each other. So Dr. Tina, we have people want to text us. We will connect you with Dr. Tina and her job in Massachusetts, but share with us as we wrap up. Forget about dentistry. What's a fun thing to do in the area, and how can people reach out to you directly?
Massachusetts is, other than being very great location, in the middle of the state, we've got, you can go hiking, there's lakes. I spend pretty much all of my weekends, oddly, in New Hampshire on the lake. New England in general is just beautiful. We have 4 seasons. There's so much to do here. There's cities. I mean, Boston is literally 50 minutes away, yet in the suburbs. So I have the best of both worlds here. We're an hour away from the beaches in Rhode Island, the endless coastline.
Cool.
you can't beat this area. You're an hour away from Portsmouth, New Hampshire, where you have great surfing, if that's your thing. So there's so much to do here. Of course, there's Martha's Vineyard and Nantucket and Cape Cod. There's just a wealth of things to do to enjoy.
She loves doing that. So that is awesome, Martina. I like what you shared about your dental life. I like to share about your personal life. How can someone reach out to you directly? We're happy to connect as part of Dentist Job Connect. But if they're listening and they hear this, how could they reach out to you directly?
You know, my cell phone is 508-989-5075. I am open to listening to anybody. And
Awesome.
you know, most things go to my voicemail, because if I don't recognize a number, I do let it go to voicemail. But I will get back to you. You can certainly email me at the email that Jill has. It's ttheroux@Theroux. But I'd love to chat with anybody who thinks they might be interested in Central Massachusetts. It's just a great community. It's thriving out here. So happy to be here.
That is awesome. This is why we do what we do at Dentist Job Connect, is to connect dentists so that you can get to the next step, be successful, decrease stress. Tina, I know you posted in the group already. I appreciate it. But this is Ariel, Ozzie, Chris, Tina. This is your Facebook Live, your content piece. And you can go and make comments and bring to life your job. So I highly recommend you go there once a day at lunch and say, hey, join me here, do this. Someone's going to see it, and we're going to find that connection for you. And I really appreciate you sharing.
Awesome. Thank you for your time. I appreciate what you're doing for us. My
pleasure. Hope we get to meet in person. So that wraps up our Job Connect show. This is what we do: bond dentists together, bring dentists out of their cave to connect. You want to see 100 plus jobs. If you want to find out how you can advertise your job on Dentist Job Connect, just text job to 215-543-6454. I've worked very hard with the Dentist Job Connect team to create a solution that's affordable for all, because this is such an important part of our industry. Thanks for being here. Remember, ABC, always be connecting, always be collaborating, always be caring. Thanks, guys.